I call the Minister for Health.
Thank you, Mr Deputy Speaker. I ask leave of the House to make a ministerial statement relating to the Australian Government's response to the International Day of Zero Tolerance on Female Genital Mutilation.
I understand it is the wish of the House to grant leave, and there being no objection, leave is granted. The Minister for Health.
Thank you. Mr Deputy Speaker, today marks the United Nations-sponsored International Day of Zero Tolerance to Female Genital Mutilation. Today, Australia joins with the international community to raise awareness about FGM. We also restate our commitment to protect the health, dignity and rights of girls and women and end the practice of FGM in Australia and overseas. The United Nations estimates that FGM affects around 140 million women worldwide. The UN Population Fund estimates that a further 3 million girls, the majority under 15 years of age, are at risk each year of having FGM performed. In December, the United Nations General Assembly adopted a landmark resolution banning female genital mutilation. 194 member states, including Australia, have committed to intensifying global efforts to end FGM. Mr Deputy Speaker, as a young woman, I read the autobiography of Nawal El-Saadawi, an Egyptian feminist, writer, activist, physician and psychiatrist, now in her 80s. At the age of 6, in 1937, Nawal El-Saadawi was pinned down by 4 women in her home in Egypt. A midwife, holding a sharpened razor blade, pulled out her clitoris and cut it off. Of this event, Nawal El-Saadawi said, "Since I was a child, that deep wound left in my body has never healed." Reading her words then affected me greatly, and remembering them now makes me determined that no girl in Australia should ever experience FGM, and that we must play our role too in helping other nations abandon FGM. FGM is common in a number of countries in Western, Eastern and Northeastern Africa, some countries in Asia and the Middle East. The number of new arrivals to Australia from countries with a high prevalence of FGM has increased in recent decades. The good news is that change is possible. The UN Population Fund estimates that some 8,000 communities across the world have abandoned the practice of FGM. There's no clear evidence on the number of migrant women in Australia who've experienced FGM in their country of birth, and building this evidence will be critical to government work in this area. But what we do know are that there are tens of thousands of women living in Australia who were born in countries where FGM is practiced, and many thousands who will need specialised obstetric and gynecological care now and in the future. There's also no clear evidence about the extent of FGM practiced in Australia. However, the Australian Government's position on this is clear. FGM is illegal. On the 11th of December 2012, the Prime Minister and I jointly announced the Australian Government's strongest possible commitment to do all we can to stop this practice being performed in Australia. It has no place in Australia. It is a violation of the human rights of girls and women. It is a crime, and it will not be excused by culture. On this day of zero tolerance, and in line with our commitments, it's important for the uncomfortable truth to be told. We know that FGM is deeply entrenched in gender inequality. The prevalence of FGM in affected communities is reflected in the status of women in social, economic and political life. That's why our efforts to improve outcomes for women and girls through support for the Millennium Development Goals is so important. FGM involves the partial or total removal of the external female genitalia. It may involve removal of the clitoris, the total or partial excision of the labia, or the stitching or narrowing of the vaginal opening. The procedure obviously has no health benefit for girls and women. All forms of FGM have immediate harm and serious long-term health implications. Pain, infection, urinary retention, chronic pain, sexual dysfunction, psychological trauma, and very significantly complications in childbirth. The greater the extent of FGM, the more common and severe the complications. Women who have undergone FGM are significantly more likely to have deliveries complicated by caesarean section, postpartum hemorrhage and episiotomy, and require resuscitation of the newborn child. And there's also, of course, a higher incidence of perinatal death. We know this because organisations like the World Health Organization are working in communities with a high prevalence of FGM. The World Health Organization is collaborating with researchers like Professor Emily Banks, who I see here today, an Australian epidemiologist and NHMRC Senior Research Fellow, to build evidence and drive home the messages about harm in communities where FGM is prevalent. The United Nations resolution also calls on countries to pay special attention to supporting women and girls who have been subjected to FGM and those at risk, including refugee women and women migrants. There's much work that is already underway in Australia. States and territories, non-government organisations, community leaders and health services are already working to end FGM and support those who are already affected. For example, women like Juliana Nkrumah, recognised in the Australia Day Honours for her significant service to the welfare of women and refugees. Juliana has been a trailblazer in raising awareness about female genital mutilation. She's worked in affected communities to bring about change from within. And people like Dr. Adele Mudolo and her team at the Multicultural Centre for Women's Health, for whom the fight against FGM is both professional and deeply personal. Late last year, I had the privilege of visiting the Royal Women's Hospital in Victoria to meet with Murray Jones, who is coordinating a de-infibulation clinic for women affected by FGM. The clinic has a team of family and reproductive rights education program workers who support women considering surgical reversal of FGM. These surgical procedures are available to women free through publicly funded hospital services. Family Planning Victoria has also been working to improve healthcare for women and girls affected by FGM and have developed care plans and advice for health professionals that has led to significant improvements in service delivery. In Family Planning New South Wales clinics, women from African, Asian and Middle Eastern countries who've experienced FGM have access to services from healthcare providers, providing specialised care in a safe and sympathetic environment. Some New South Wales hospitals have done a marvellous job adapting to the needs of the women they serve. In Tasmania, the Red Cross is successfully operating an FGM education program. In WA, the Women's Wellness and FGM Clinic is providing important services from the King Edward Hospital in Perth. Family Planning Queensland and the Multicultural Women's Health Project is mobilising Queensland community leaders and employing health educators to work within communities. Unfortunately, despite increased demand on services, their funding has remained static for the last 5 years. Mr Deputy Speaker, since 1996, the South Australian Refugee Women's Health and Safety Program has been working with affected communities, health professionals, child protection workers, police and education authorities in an effort to address FGM. I'd like to acknowledge the important role of the professional colleges in supporting health professionals to assist women affected by FGM. I've held discussions with several colleges in recent months about redoubling our efforts to end FGM and to support women who have had the procedure. The Royal Australian and New Zealand College of Obstetricians and Gynaecologists, the College of Nursing, College of Midwives and the Royal Australasian College of Physicians are absolutely committed to this issue. They bring to this issue enormous professional expertise and experience. An enforceable legal framework is absolutely critical in combating FGM. While laws concerning FGM are primarily a matter for states and territories, the Federal Attorney-General is working with the states and territories to identify opportunities to strengthen Australia's legal framework in relation to the practice. All states and territories have enacted legislation making it a criminal offence to perform FGM on any person or to remove a child for the purpose of performing FGM. The maximum penalties for these offences range from 7 years imprisonment to 21 years imprisonment. But we know that there are limits to the capacity of our legal system to bring about change where cultural practices are deeply embedded communities. Cultural and attitudinal change comes about through a far wider range of mechanisms and approaches. I'm leading the Australian Government efforts on this front and working closely with other Commonwealth ministers, state and territory governments, non-government organisations, communities and individuals. Our efforts are focused on supporting communities to abandon the practice of FGM while also preventing new cases, enforcing a legal framework consistent with zero tolerance and ensuring there is appropriate support available to women and girls who've been affected by FGM. In the near future, the Government will announce $500,000 in grants available to organisations for education and awareness activities. This will support change within communities, as we know public education and awareness is key to change. Today I can also announce that the National Summit on Female Genital Mutilation, foreshadowed by the Prime Minister in December, will be held on the 9th of April this year. The summit will bring together a range of health, community and legal experts to discuss ways to assist communities to abandon FGM both here and abroad. I was speaking to AJ Rane, a physician very experienced in this area, Mr Deputy Speaker, and he said, and I think we all believe, that we owe it to every girl and every woman to ensure that they never experience FGM. And to those who have, we owe them a responsibility to ensure that they receive appropriate care when they need it. Thank you.
Thank you.